Hello everyone, myself Kanchan Sinha from SHRI MAHAVIDYALAYA JUNWANI BHILAI. Today I am going to discuss the topic orthopedic impairment, which is from the MEd 4th semester unit 3 subject education for differentially abled. Orthopedic impairment is the most common of physical disabilities. Physical impairment means certain type of dysfunction and disturbance in the body resulting into its malfunctioning. Under federal law, an orthopedic impairment means a severe bodily impairment that adversely affects a child's education and performance. An orthopedic impairment involves the skeletal system, bones, joints, and limitations of associated muscles. Orthopedic impairment is also known as physical disability. It is significant physical limitation that impairs the ability to move or to complete motor activities. Orthopedic children suffer from impairments of their muscles, skeletal or nervous system that may interfere with their natural functioning. The Individuals with Disability Education Act defines an orthopedic impairment as any condition that interferes with a student's ability to use his or her body and thus that severely and adversely affects a child's educational performance. This slide shows certain characteristics of orthopedic impairments. First, average or above average intelligence. Second, have shorter attention span. Third, dependent on adults. Fourth, deformity. Fifth, inaccurate coordination of limbs. Sixth, high anxiety frustration. Seventh, paralysis. Eighth, jerky movements. And ninth, difficulty in walking and grasping. Some other characteristics of children with orthopedic impairments are problems with motor skills. Some students have associated speech impairments or multiple disabilities. Use various types of braces, prosthetic and orthotic devices before, after or in place of surgery. Others use adapted wheelchairs. Social interaction often are limited. Other characters are may have pain and discomfort, may sleep poorly and therefore be fatigued in class, poor self-concept and self-advocacy skills, feel helpless or depressed as a result of their physical disability. There are many types of orthopedic impairment. The main five types are as follows: osteomyelitis, spinal tuberculosis, cerebral palsy, the cleft lip, and angular bone deformity. Osteomyelitis is a chronic condition affecting an individual's bone and joints. It is triggered by specific due to the presence of bacteria and infection. Pus is produced by the immune system, which can result in the discharge with bad odor. This condition is most often introduced into the body through untreated aberrations, and if it is not treated quickly, reconstructive orthopedic surgery may be required. Spinal tuberculosis. Tuberculosis, also known as TB, is highly infectious disease that can result in severe symptoms and death. When it is evident in the spine, it will cause a disintegration of the spinal column and the nerves. During this process, the impairment can be detrimental and will affect various areas of the individual's life, therefore resulting in death if not treated correctly. Spinal tuberculosis can be identified in the thickening of the chest after a sharp bend is evident in the spinal region. Cerebral palsy is technically a type of chronic motor condition affecting the body entirely. It can lead to be an inability to move, a lack of muscle tone, and a lack of muscle coordination. In the most severe cases, cerebral palsy will result in brain damage, and the patient can experience a loss of mental capacity. This is particularly evident if the condition occurs when the baby is in the womb. The cleft lip. It is a common deformity and will occur as part of childhood development. The various parts of the face continue to form, and typically the body will fuse the areas together. However, if the fusion between the medial and maxillary nasal regions are not adequately fused, a cleft is formed. As you can see in the picture, the first baby shows unilateral cleft lip. The second baby shows bilateral cleft lip, and third have the normal palate. The next type of orthopedic impairment is angular bone deformity. As you can see in the figure, an angular bone deformity is a simple bending of the bones above the knee and is a result of variation in normal growth patterns. The angular deformity will contribute to knock knees or bow legs, and this can become worse as the child ages. This is considered as orthopedic impairment because if this is not treated, it can lead to unavoidable joint damage. There are three main causes of orthopedic impairment. The first, hereditary factor; the second, congenital factors; and the third, environmental factors. The first cause of orthopedic impairment is hereditary factor. It can refer to inheriting characteristics from your parents, or it can refer more broadly to the passing on of genetic factor from one generation to the next. Following are the orthopedic impairment occurs due to hereditary factors. Number 1, dislocation of hip. Second, achondroplasia. Next, cleft palate, club foot, osteogenesis imperfecta, cleft lip, Marfan syndrome, spina bifida, and cerebral palsy. This slide shows the different orthopedic impairment caused by hereditary. As you can see the figure, the first one is Marfan syndrome. This is a development of poor muscles and curvature of the spine. Second, club foot. It is a deformed foot which is twisted so that sole cannot be placed on the ground. Third, osteogenesis imperfecta. Children have brittle bone and are prone to fracture. It is also known as Lobenstein syndrome. Spina bifida. As the name suggests, as you can see in the figure, there is split in the spine. It occurs when mother lacks folic acid during pregnancy. Cerebral palsy. Cerebral means the presence of causative lesion or damage to the brain, and palsy means consequences of such lesion in terms of loss or impairment in motor functioning. Next one is dislocation of the hip. As the name suggests, the hip portions are dislocated in the developmental stage, and the cause of this impairment is lack of amniotic fluid in the womb of the mother. The next orthopedic impairment is achondroplasia, caused by gene mutation and is associated with advanced paternal age. Gene mutation affects bone formation. As you can see in the figure, the body of the child is not properly developed to affected bone formation. The next one, cleft lip. It is a birth defect that results in a unilateral or bilateral opening in the upper lip between the mouth and the nose. The next one is cleft palate. It is also a birth defect characterized by an opening in the roof of the mouth caused by a lack of tissue development. The second cause of orthopedic impairment is congenital defect. This condition occurs at birth or before birth or develops during first month of life regardless of causation. A congenital disorder may be the result of genetic abnormalities, the intrauterine environment, errors of morphogenesis, infection or a chromosomal abnormality. Congenital defects may cause missing bones, webbed finger, cleft lip, etc. It may be due to infection, lack of child immunization, various diseases, doses of drugs, disease like rubella, German measles, microcephalia, hydrocephalia, and cataract. As you can see in the figure about the polio, also called as infantile paralysis, it is an acute infectious disease spread from person to person. Virus enters the central nervous system and cause motor problem. The third important cause of orthopedic impairment is environmental factor. Environmental factors are those which affects an individual externally or are not related to genetic level. It is divided into three parts: prenatal environmental factor, postnatal environmental factor, and perinatal environmental factor. Prenatal environmental factor. In this, the word prenatal means before birth. The factors which is affecting the body of the child before birth. The factors are oxygen deprivation, RH incompatibility, intoxication, toxemia, viral infection for the expected mother, brain damage, brain fever, malnourished mother, drug addiction of mother, exposure to radioactive rays, smoking, and tobacco products. Postnatal environmental factor. Here, the word postnatal means the period after childbirth. The factors are cesarean cases, infection with chronic diseases, unhygienic conditions, oxygen deprivation, improper use of forceps or anesthesia, accidental and incidental factors, TB of joints, sinus, certain fever after birth, and prolonged labor. Perinatal environmental factor. Here the word perinatal means near or around the time of birth. The factors are poverty and socio-economic conditions, child abuse, accidental and incidental factors, lead poisoning, polio, burns and injuries, malnutrition, vein blocking, spinal injury, lack of vitamin D or calcium, intoxication, inhalation of heavy metal, and hypoxia. In this slide, we will discuss the two factors of perinatal environmental factor, that is child abuse and poverty and low socioeconomic condition. The child abuses are beaten, burned, sexually molested, neglected by parents, which can result in facial disfigurement, skeletal deformity, muscular damage, disabilities, sensory impairment, and neurological damage. Among poverty and low socioeconomic condition are child marriage. Child mothers can deliver premature babies. Second, illiteracy. Third, unhealthy living, which can damage to the normal growth and development, which result in physical deformities. Other causes of orthopedic impairments are neuromotor impairment, musculoskeletal disorder, degenerative diseases. Neuromotor impairments involves the central nervous system, that is brain, spinal cord or nerves that send impulses to the muscles. It affects a child's ability to move, use, feel or control few parts of the body, spinophilia, cerebral palsy and spinal cord injuries. Second one, musculoskeletal disorder, MSD, are injuries and disorders that affects the human body's movement, muscles, bones, joints, tendons, ligaments, nerves, disc, blood vessels. Third is degenerative diseases, which are based on degenerative cell changes affecting tissues or organs, which will deteriorate over time, whether due to normal bodily wear or unhealthy lifestyle. Other causes of orthopedic impairment are scoliosis. It is a sideways curve of the spine measured by X-ray examination as greater than 10 degrees, which you can see in the figure. It makes the shoulders, hips or both appear uneven and can cause pain in the back. The next is muscular dystrophy. It is characterized by progressive rapid muscle weakness, defects in muscle protein, and the death of muscle cells and tissues. It often occurs in families with no known history of the disease. Muscular dystrophy are progressive, but those such as cerebral palsy and epilepsy can be improved with treatment. How we can prevent orthopedic impairment? The prevention are as follows. To prevent orthopedic impairment that results from preventable diseases, it is important to focus on health education, nutrition, and immunization. This includes relatively simple procedures such as raising awareness of the importance of cleanliness, medical care, and nutrition for the development of strong bones, monitoring birth to avoid conditions resulting from complicated births, and administering polio vaccination to prevent polio and post-polio syndrome. Regular medical care should be done, including preventive and follow-up care. Not smoking. The mother should not smoke, should not use alcohol or caffeine intake, eating a balanced diet of mother, maintaining an appropriate body weight for your height and age, and lastly, getting, but not the least, getting regular physical exercise as allowed by your disability. We can conclude that orthopedic impaired children are those who suffer from defects, deformities, and disturbance related to muscles, joints, and skeletal system. These impairments can occur because of various causes, but it is possible to treat these impairments, but they can't be cured. Caution is must if we want to avoid this impairment. Thank you for listening this video and hope you might have understood some part, some reasons, some causes of orthopedic impairment. Thank you once again. These are the references that the matter taken from these sites. Thank you once again.